This is QD Clinic, and this is a tale of two gouts. In one day, I saw two gout patients. One woman, one man. She was 63, he was 45. She's had gout symptoms and has been largely untreated or treated horrifically for the last 6 years. He has had a 15-year history of mismanagement of his gout. They're both on colchicine and steroids and nonsteroidals in varying amounts in the last, let's just say, 6 months. She has never been on allopurinol despite having, clear-cut radiographic punched-out erosions from urate deposits and multiple gout attacks. It used to be 3 a year, and now it's like 6 a year, and now it's just an attack going on for a month or something really long. He has been on allopurinol either 100 or 300 going back and forth because someone's worried about his creatinine of 1.2. So, what do we learn from these two cases? Number one, whoever's managing gout in this world doesn't know crap from tuna fish. My goodness. Gout management by non-rheumatologists, and by the way, rheumatologists don't always do a great job here, but by non-rheumatologists, ER doctors, family doctors, OBGYNs, podiatrists, God knows who's been involved in the care of these two individuals, but they all get, a very generous F in gout management. Yet everyone thinks they know how to manage gout. So if you're a non-rheumatologist and listening to this and you're greatly offended by what I've said, good. Come to Dallas and show me how you manage gout, and I can poke holes in your management. Again, gout is not easy to manage. If it was, we wouldn't have all this destructive damage being done by gout. 8.1 million Americans with gout, and less than like 2% are being seen by rheumatologists? That isn't right. I certainly would want a higher number for your mother who has rheumatoid arthritis or for your aunt who has lupus. Why shouldn't your uncle who has gout, chronic gout, be managed by someone who actually studies it, lives it, breathes it, treats it? Everybody else is a part-timer. Second, acute gout management. People, wake up. Colchicine was the drug of the day in the time of Hippocrates. Why would you give a drug where the express goal is diarrhea and abdominal cramping, even if you're using just 3 pills a day? Wake up. Use nonsteroidals. If you can't use nonsteroidals, use steroids. It works great. Since colchicine became a very expensive drug, I haven't prescribed colchicine for anyone. Not for gout, not for pseudo-gout, not for FMF. I mean, maybe one of those. But honestly, I don't need colchicine to manage gout. So wake up. Use steroids. Use nonsteroidals. That's how you get over acute gout. Lastly, allopurinol management. Lord knows what the hell people are thinking when they're doing this. Obviously, you start low. 100 milligrams is what I do. I give it for a week or two. If they tolerate it, fine. Then they immediately go to 300. And then it's treat to target, meaning you're monitoring and you're making the goal, get their uric acid below 6. And if they have tophi, below 5. And if you're not getting there, you escalate the dose. Still, even amongst rheumatologists, the number is like 90% of rheumatologists and their patients are on 300 milligrams a day. And I would assume rheumatologists are managing the difficult gout patients. Meaning, I don't know what happens. Thinking and management seems to cease when you hit 300 milligrams a day. How many people do you have that are taking 450 or 600 or 800? And there's too much worry about renal function in people who you use allopurinol in. Yes, you follow their creatinine, but you can safely use high doses, including 600 or even the max 800 in people who have renal insufficiency. You just follow their creatinine. When it seems to be affected, you cut back on the dose. This is different than colchicine, where you clearly have to be very, very careful about using colchicine and its dosing in people who have creatinines that are approaching 2 or higher. Allopurinol, be liberal, keep monitoring, be aggressive. This is how you manage gout. At least that's how I think you should. We'll see you at Room Now Live. It's in March.